Hi, I'm Dr. Tiana Seetzy at Rejuvenation MD in Burlington and Bellingham, Washington, and today we are doing a breast lift with threads. And this is a really easy procedure in general to do. What we're doing is we're taking PDO threads and we're injecting them and we're placing them into the breasts to help give a lift without having to undergo any kind of surgical procedure. So I've just put some lidocaine in a few areas here, and now I'm going to put the thread in right through my little port. So she shouldn't feel much. Turn your head a little bit farther for me, thank you. Let's see. Oh, yeah, that's good. Now we're gonna just push under. You'll let me know if you hate me or if this hurts, and I'll give you some lidocaine. But there's all sorts of different PDO threads that we can use for this type of a lift. She has a little larger breast. I like to use the larger threads. So they have barbs on them, so they stay in place even after we take the thread out. So I'm coming out. You okay?
Mm-hmm.
Okay. Was that easy, hard?
It was good.
Okay. Awesome. All right, so we're going to go to the next one. Really depends on what size breast you have as to how many threads we're going to use. We're going to start with 3 for our patient here, but she may need more depending on her results. The threads are made out of polydioxanone, which is what the surgeons use in surgery. So if you've had surgery and the surgeon said, don't bother to come back because those are going to dissolve, it's the same type of thread that we're using here. You okay?
Mm-hmm.
Excellent. So we don't get allergic reactions and things like that from these threads. And one more here. One more. I might just go over a tiny bit farther. Hold on 1 second. Get this. Go over a tiny bit farther over here. One more little spot. 1, 2, 3. La la la. Little lidocaine. Are you okay?
Mm-hmm.
Okay. So one more there. But it's a pretty easy procedure to do in the office. Does not take much time, as we're all seeing. And the results are quick right now, but they're also she's going to get more and more and more over the next 3 months or so, because it takes that long to make collagen. Can you feel that?
No.
No? Okay. 1, 2, 3, a little love right there. Okay. I'll just do this. So we can do this with the breasts. We could put these over the knees if there was some excess knee tissue that you don't like. We could put this in the booty. Pressure, think happy thoughts. To lift the booty, it's really nice in combination with cool tone. If you're lifting the booty with the cool tone to increase muscle. So that's a nice combo treatment. There we go. All right, so that side's done. How do you feel? Are you okay?
Mm-hmm.
Awesome. So we'll be pulling these. Excellent. Okay. So we're going to go to the other side, and let's do the other side now. All right, so we're on our other side now. We're going to do a little channel. Go right along here. Turn your head towards me now. There we go. There we go. Sorry. There we go. Let's pull that breast up. Yeah, this is just a great alternative to surgery Lots of times we'll combine this breast lift with PRP, platelet-rich plasma. And what the PRP will do will make you make collagen. Well, I should start by telling you that we draw your blood, we spin it down, we take the platelets, and then we inject the platelets around the middle to the top part of the breast on both sides there. And then we take the platelet poor plasma, what we have left, and we do it around the side, the bottom. You can go underneath the nipple to help improve skin sensitivity. Sometimes though, PRP can make you grow by 1 or 2 cup sizes. So when people have larger breasts, it's not, you know, I can't assure you, 1, 2, 3, that won't happen. So what are our alternatives? The alternative would be doing thread lift by itself. The other thing that you could do to breasts is you can put some Sculptra in there. Turn more towards me. And that will make you make collagen. Right in this upper section we would place it. It's just another way to make collagen. I mean, the whole name of this game is how do I make collagen? How do I bring things up? I can bring things up and make collagen by doing threads, Sculptra. You can even do Radius, which is another type of filler. Are you okay? Sorry. I'll be out in just a sec. Okay, I'm out. Sorry. Oh yeah, I made that one bleed. I'm sorry. That one might bruise. Will this hold a little pressure? You okay?
Mm-hmm.
Okay. As you can tell, these aren't very small. These are cannulas are 18 gauge, so they're fairly large, but that's because they're delivering a large gauge thread. So it's also a blunt tip, so I could try poking myself with it, but it won't poke me because there's no needle at the end of it. Although that might have felt like a needle. It does not. And so as I go through the tissue with this blunt tip, it also is making you produce collagen because I'm irritating a bunch of the cells. Sometimes our patients also, but I'm irritating a bunch of the cells as I go through with this, and then the cells go into fight or flight mode. Well, the cells are stuck in the tissue, so they fight back by making more collagen. So just by the way we deliver these threads, it will help you make collagen. So we like making collagen however we can. Especially when people are young, they tend to make more collagen than when we're older. We stop making collagen at age 35. Unfortunately, some of us are past that prime, but not prime, because you know, 40 is a new 30, and maybe 50 is a new 32. But anyway, I digress. Okay, one more over here. 1, 2, 3, little love right there. Okay, you okay?
Mm-hmm.
Now that I'm done with that other one. And I'll be done with this in just a sec here. Alright, let's get this breast up. Okay, a little pressure. Now I explained to her all these things so now she can feel it all. But we'll be done just here in just a minute. And that'll be all good. There we go. Okay. You okay? Yeah, I'm not poking you anymore.
Okay.
So now, oh good. So now what I'm going to do is I'm just going to pull on the threads and we'll fasten them in. What did I do with my arnica? Oh, I left it out. I was prepared. Look at me. Okay. Look at me go. All right. So I'm just going to push the barbs to have them grab onto the tissue down there. And I'm saying a lot. Sorry about that. Well, this is really an easy procedure in general. Should not like this one, so we won't push too hard on that guy. And we'll get those out in just a sec. A little bit more arnica. So you can, if you're going to bruise, you can take some arnica. That's always helpful. There we go. So again, combination treatments are great. Adding PRP, Sculptra, Radius, any of those types of treatments to make you make collagen are nice lifting types of procedures. So all I'm going to do is just snip the ends of these off. And nobody will be the wiser And she can go about her day, the rest of her day, just normally. She doesn't have any downtime. I prefer if she's going to exercise, I would tell her not to do anything that's real bouncy. Okay, because you don't want to irritate these little guys. I prefer, I've done the PRP breast lift, and I like doing a double brawing when we're doing, when I was exercising for maybe about a week. I didn't do the threads at that time because they weren't out yet with us, but imagine that would feel the same with these. Maybe just double braw and give yourself a little extra support there. And then that's really the only aftercare. Side effects, there's really no side effects again, other than bruising. A little drop of blood coming over here. See about that? I guess that's not really a side effect. I guess that's just kind of an annoyance of doing things like this that involve needles and things like that. So, and she'll see an immediate lift, but then over the next couple weeks especially, it'll get better and better. And then over the next 3 months, it'll get better and better. So it's one of those things you just kind of have to be patient for. These work, and again, you know, sometimes people need to do more than, you know, sometimes we start off with some and then go, okay, you know what, I really like that, let's do a few more because I just want a little bit more lift. But super easy in-office procedure, no downtime. Anybody's really a candidate. I don't know anybody that wouldn't be a candidate for this, so that's a good thing. We like to be able to do it on everybody. And if I can do a procedure like this, anybody can do a procedure like this, because I am a sissy, although our patient is not a sissy. She held in pretty good here. You okay?
Oh, yeah.
Okay, good. Awesome. And we'll just wipe that off. And gradually you'll see more and more improvements. So if you have any questions about PRP breast lift, either with PRP, Sculptra, or just PDO thread lifts, you can go online at rejuvenationmdmedspa.com, or feel free to call us. We offer free consultations, and we can see if this is the right procedure for you. So hope to see you here.